Well, for this month's Buddy Call, we're talking about genetic testing. Now, it can sound intimidating, but health experts, they say it can actually be a powerful tool to help people take control of their health.
Yes, I sat down with a genetic counselor to learn who should consider testing and what those results may mean. Breast cancer is one of the most common cancers for women in the United States, but Ellen Linebaugh, a certified genetic counselor, says it does not always strike at random. Sometimes the answer is in your DNA.
Anytime we see 3 people in a family who have had breast cancer or a male breast cancer, or if there's also a family history of things like prostate cancer or pancreatic or ovarian cancer, those are red flags for us to say, okay, there might be some sort of underlying genetic cause.
And for women who have already been diagnosed, genetic testing can change the course of treatment.
For women who are considering a lumpectomy versus a mastectomy to remove both breasts, genetic testing can be particularly helpful. If we know someone's at risk for another breast cancer going forward, that may inform their surgery. Sometimes there are certain medications that work better for women who have a certain mutation in a gene that increases the risk for breast cancer.
Medical experts say genetic testing can not only help the patient, it also can help their whole family.
If we find a mutation in a gene that we know increases the risk for breast cancer, that could inform that woman's children. So anytime we find a change like that in a gene, it's usually a 50-50 chance for each of that person's children to inherit that. And in that situation, we can start screening those women earlier in life. They can consider even preventative surgeries sometimes, just depending on what the genetic testing says.
Here's something important to know. A clear mammogram is not the same as a clear genetic picture. Linebaugh says a negative mammogram tells you what's happening right now. Genetic testing tells you what could happen down the road. And at Lexington Health, you don't even need a referral to start that conversation. The counseling itself is free for Lexington Health patients. Go and get your mammogram, and your mammogram comes back as everything is clear. Is it still recommended, though, to get genetic testing if you have family members who have had breast cancer?
Yeah, absolutely. Genetic testing isn't going to tell you whether or not you have cancer. It tells you whether or not you're at risk to get cancer. So having a negative mammogram doesn't inform what is going to happen in the future. So genetic testing might be helpful for that.
Linebaugh's message to women sitting on the fence: call your family members. Find out who's had cancer, what kind, and how old they were. That information alone could be the first step toward protecting your life. And Linebaugh says many people have concerns about privacy and cost when it comes to genetic testing. Well, she says genetic information is protected under HIPAA, so no worries there. And she also explained that there are financial assistance programs for those who may need them.